Are you looking for a natural substitute for prednisone if you're taking it for ulcerative colitis? Hi, I'm Dr. Megan, the prednisone pharmacist, and I can completely understand why you'd want a natural substitute for prednisone because it causes more side effects than any other drug. So, I can share with you 5 or more natural substitutes for prednisone so that you can minimize the amount of this miserable drug that I personally had to take and get the symptom relief that you need. Now, this information comes from the Natural Medicines database, and it is an evidence-based database where they took all of the scientific evidence and then combined it and ranked it. And each natural substitute is given a ranking of how effective it likely is based on the evidence that actually exists out there. And so they go from not effective, likely effective, all the way up to possibly effective, and then effective. Like it definitely works. It's basically an FDA approved drug at that point. And so these ones I'm about to cover are possibly effective. There's a lot of good evidence, but we're not to the point where, oh, this should be treated as a drug. It's so good. Okay, so these are the 5 natural substitutes for prednisone for ulcerative colitis, according to the Natural Medicines database. The first one they mention is called Andrographis, and this is an extract that has been shown to be promising for ulcerative colitis symptoms. Second is lactobacillus plantarum and other probiotics. This specific strain of probiotics has been shown to reduce symptoms and get more people into remission to prevent symptom relapse when compared with standard treatment. Number 3 is phosphatidylcholine. This is a phospholipid. It's basically on the cell membrane. The phospholipid bilayer is what makes the edge of a cell. It's like the border of the cell. And so phosphatidylcholine is one of those phospholipids. And it might be deficient in people who have ulcerative colitis. So building up a better barrier in the gut lining is kind of the idea behind phosphatidylcholine. In a study of 3 clinical trials, they showed that 49% of people who took phosphatidylcholine were able to achieve remission. And it improved quality of life. They even had one study that 80% of people were able to completely stop using steroids. That's amazing. And the effective dose is at least 1 gram daily, but you might need 3 to 4 grams per day. Number 4 is propanol L-carnitine, and this might help improve clinical relapse rates and remission rates. Number 5 is vitamin A. Now, vitamin A has been shown to help with mucosal healing, to help heal the mucous membrane in the gut. So those were the 5 natural substitutes for prednisone that you can use for ulcerative colitis. But if you're finding that you've tried everything and you still have to use prednisone, you have no other alternative at this point, and you have to use prednisone, the idea now is to make every single milligram of prednisone matter, to minimize the side effects in whatever way you possibly can. That's how I felt when I was personally taking prednisone, that there has to be something better to make this experience not so horrible and miserable. And so what I realized is that if you replenish the nutrients that prednisone is stealing from our bodies, then that will help us not feel so awful. So what I did is I invented Nutrinizone. It's meant to be combined with prednisone, that you take your prednisone pill in the morning along with your Nutrinizone. And then you take your bedtime 2 capsules to help you sleep restfully at night. So the combination of this helps to minimize the side effects so that while you're taking prednisone, it's as pleasant as possible and that you're doing the choice you have to do of taking prednisone, but making it matter and doing everything you can to feel the best you can. Thousands of people have taken this and have shown that it helps them feel like themselves again while taking prednisone. So all you have to do is go to nutranize.com, nutranize.com, to get your own today. Signing off as Dr. Megan, your prednisone pharmacist.